Welcome to another episode of Healthcare Matters. Today we are going to deep dive into the heart of patient advocacy in Bulgaria and beyond. Together we will explore the impactful work of Retina Bulgaria and the important changes that need to happen in the policy landscape in Bulgaria to support people with vision impairment and rare diseases. We are delighted to host Dr. Petya Stratieva, the president of Retina Bulgaria. She will discuss and share with us the vision of the organization and the ongoing projects to help our patients in Bulgaria. Warm welcome, Petya. Thank you so much for being with us today. And let me start by asking you, how are you today?
Thank you very much, Kasham. It's really lovely to meet you and to be together with you today. So I'm fine.
Great to have you. And for those who doesn't know you well, what would you tell us about yourself? Maybe in one sentence, but maybe in more. What would you like to share with us about yourself?
I think that I'm a dreamer who strives and who is trying always to make her dreams a reality. And in order to make them reality, usually what I'm doing for many years, I'm trying also to find the right people with whom I can make my dreams reality. And it is both in my private and in my professional life. It is going like that. The challenge is only that I have sometimes new dreams, which means that I have to find again new people with whom we could go ahead in order to make our common dreams a reality.
Dreamers usually do great things, for humanity. And usually dreamers have great vision as well. And that will take me to my first question, that I'm very curious to know more about your vision for Retina Bulgaria and some of the important ongoing projects.
We have created Retina Bulgaria in 2018, but those of us who have created Retina Bulgaria have communicated between each other. Probably 20 years ago, we started to communicate between ourselves because actually there is still no cure for many of us. There wasn't any way and pathway to the diagnosis, so we have started to do so, to find for ourselves solutions. And at the end, in 2018, we have created the organization. It is an organization created by patients for patients. Our mission is to support policies and research and innovations for people living with retinal degenerations, with all types of retinal degenerations, meaning these are the inherited retinal dystrophies, which is quite a big group. They are rare diseases. This is actually the leading cause for blindness among the young generation. At the same time, we are trying to support policies and innovations, research and innovations for people who are with age-related retinal degenerations. These are common diseases, two very big groups. The first one, these are people with diabetic retinopathy and diabetic eye disease. Usually, these are people who are affected, and it is the main cause for blindness among the working generation. But something on what we are really also currently focused quite intensively is the field of the age-related macular degeneration, both types, the geographic atrophy and the dry age-related macular degeneration, and the neovascular retinal degeneration, which is another type of disease which actually during the recent years has already received a cure, because there wasn't a cure for this previously.
Great. So big focus on policy changes and on research and innovation. And with your extensive international experience and European engagement, would you share with us some of the European projects that either you work currently with Bulgaria or even you aspire to bring them to Bulgaria?
Thank you for this question. Actually, here with regards to Bulgaria, what we are currently doing, as I said, we are working in these domains. I have just mentioned them. But with regards to the European projects, what I believe personally, and not only me, it's that the networking really matters. And with regards to the rare diseases, we are part of a very big initiative driven by the European Commission. It's the European Reference Network for Rare Eye Diseases. Probably you know that in the field of rare disease there are 24 European reference networks. They consist from hospitals where actually the main research, clinical trials, the treatment with advanced medicinal product is really performed. So we are, and I'm also personally part of the governance board of the European Rare Disease Network for Rare Eye Diseases. At the same time, we have also some other projects which are dedicated to age-related macular degeneration. We are part of Retina International, and for several years already we are participating at some projects of Retina International which are dedicated to exactly to people with age-related macular degenerations. Something what we would like really to do in the very near future is that we would like to be part of the so-called Action for AMD. It's an initiative of Retina International targeting the politicians to increase their knowledge about eye care and especially for the eye care of the elderly in order to curb a little bit this trend, curve down, I mean, this trend of the vision loss related to the 21st century population's aging. The world is aging, Europe is aging on a faster pace. There isn't any comprehensive framework at all, a policy framework for eye health in principle in Europe, neither in Bulgaria. And there isn't any also framework for the vision health for the elderly population, and it is something what actually together with Retina International we are trying currently to move forwards. So it's a policy initiative called Action for AMD for all over Europe, and here in Bulgaria we would like to be part of this initiative.
And because you mentioned focus on politicians, I'm curious from your experience, I'm curious about your insights, how non-governmental organizations like patient organizations can work effectively with policymakers and politicians. What was your experience and recommendation so far?
Actually, Hisham, what I believe is that if people are together behind something, some values, some common objectives, let's call them projects, in this case they could really do something together. And it is similarly with the patient organizations or whoever civil organizations and authorities, or with the politicians. But with regards to the politicians, what we could do, of course, is to educate them. With regards to the authorities, I mean, with the institution like the Ministry of Health, of course, it would be nice if in Bulgaria we could have some common projects with the Ministry of Health. In principle, it is not excluded because we can take the good example of the Ministry of Social Affairs, which has common projects together with civil organizations. Regretfully, our Ministry of Health doesn't have such an experience. But what we can do, of course, is to make analysis, to make reports, to provide papers. I'm not speaking here about different kinds of papers, let's say reports, to try to put them together behind what we are suggesting, to discuss with them, to issue statements, joint statements with them, and to try jointly to discuss legislative pieces which are actually supposed to form different kind of policies, because anyway, whatever policy, it means that there should be a legislative piece behind, whether it could be, of course, an ordinance, it could be a primary legislation, a legislative act, but our aim of the patient organizations is to defend the European values and the European rights, and we should not forget that the healthcare, despite of being only national competence, is right, especially here in Europe, is a human right for all of the European countries, because the protection of the health care is part of the Lisbon Treaty, which each separate European country has signed while joining the EU. So the healthcare, the defense of the healthcare, the healthcare protection is exactly part of this heart of rights and values, and we are supposed really to defend it, because sometimes the government and the politicians are forgetting about that, and we have to remind them.
So very important to remind them, have a common vision, really go with education, thorough analysis and studies, as you said, that can lead into a policy change. So we can see really vision health as a right of each European citizen. And that will take me to the next question, which is related to what are some of the key challenges and some of the pressing needs for people living with vision impairment in Bulgaria, especially considering the socio-economic burden also on Bulgaria and on the society?
So I'm really happy that you're asking me about that, since actually, usually, you know, when we are talking about healthcare, very often the perspective of the healthcare providers is taken into account, very often the perspective of the politicians, but actually the perspective of the patients, what really matters to them, it's quite important. And we are happy to see that even the EMA is already trying really always to take already the patient perspective into account. So what are here the most pressing issues for us, where are the gaps is, firstly, it's the access to diagnosis, whatever the diagnosis could be. If in the case for people who are younger and who have inherited retinal dystrophy, it is still a very big challenge, since the diagnosis is supposed to be genetically made, and there is still no pathway of the patients to the diagnosis, and this odyssey continues in Bulgaria especially. When we are talking about people with age-related macular degenerations, there isn't any screening program. But when we are talking what actually matters for patients, their concerns are related mainly to two elements. The first one is the well-being, and the second one is the productivity. Meaning that when we're talking about diagnosis, care, treatment, the patients, they expect exactly that, a treatment which will provide to them a better well-being, a treatment which will provide to them the opportunity to stay longer productive, even when they are retired. Because productivity, when you're aging, productivity, it means to be autonomous, to be able to help to your family, to take care of your grandchildren, to be able to move without the help of somebody else at home. So these are really the well-being and the productivity are most important for people who are aging with visual impairment. And in order really to preserve this well-being and productivity, in that case, of course, what we need is, on one hand, timely access to screening, timely access to innovations, meaning new therapies, having new therapies. Therefore, we are supporting innovations, you know, the really new therapies to be brought to our hands, to the patients, and also timely access to rehabilitation. The rehabilitation and the mental health, because both the patients and their caregivers, they have really huge mental health needs, starting only at the time of the diagnosis and throughout the patient journey. These are things which they can't be brought to the patients without the consensus of the policymakers.
Thank you. I really loved how you covered the full patient journey, starting from screening, access to diagnosis, access to innovative treatment, then work on the rehabilitation. And that will also create this well-being and productivity. I even envisioned a patient in a better state when you were speaking about well-being and productivity. And that will take me to the future, to the desired state. So would you share with us, how would you envision the future? What is the future focus of Retina Bulgaria? What would be your focus in the near future?
So there are challenges, there are objectives we could not reach alone. We need the help of other patient organizations, and also we need to join efforts also with the medical specialists. with regards to rare disease, for example, because, as I said, there are challenges where nobody in Europe could solve by himself or by herself alone. Very recently started here, meaning on 1st of January 2026, started a 3 years joint action on rare diseases for the integration of the European reference networks for rare disease into the national healthcare system. And we are happy that we, the patient advocates, we have managed to convince our authorities in 2022 to commit, meaning also finding some budget, national budget for that, to participate to this joint action where around 30 countries from Europe will participate, EU27 plus three more countries, Norway plus Ukraine inclusively. So during the next 3 years, we are going to participate together with the nominated institution. It's the Medical University of Sofia, to this joint action, and we hope that we are going to have the active participants from the Ministry of Health. So it means that during the next 3 years we'll be focused on this joint action on rare diseases. And this joint action is supposed to improve the diagnosis, treatment and care for people living with rare diseases. Something what we are going also to engage with, and it is also already decided, it has started to cook 3 years or 4 years even ago, but it will start in September and it will last probably 7 to 10 years, is the European Partnership for Rare Diseases. It is called actually already ERDR, it's the European Research Alliance for Rare Diseases, which is focused on patient needs for development of new treatments, and we, the patients, will be part of this European alliance. Will be mainly focused on the national and international alignment of the different stakeholders. In terms of aging, and also in terms only of eye diseases, once we have our initiative, Retina Bulgaria initiative called Target 4000, where we are focused on creation of a national expert center in Alexandrovska Hospital for people, and also in Varna, of course, because at least 2 expert centers are needed for people living with inherited retinal dystrophies, and we are trying to align them with the European Reference Network for Rare Diseases, to be part of the European registries, to be part of this really network. And last but not least, with regards to AMD, to the age-related macular degenerations, we'll continue to push forwards for policies for people who are aging with age-related macular degenerations. It's a very special cohort. They need really attention, and the policies which are supposed to be addressed are partially in terms of healthcare, partially in terms of social affairs, but we have really jointly with the medical specialist go forward, since what we have socioeconomic data, also socioeconomic data about AMD from Bulgaria, which means that we are able to bring to the public debate evidences in order to generate, let's say, evidence-based policy debate, in order to be able to formulate evidence-based policies for people affected by age-related macular degenerations and their caregivers.
Thank you. Thank you. Very comprehensive, and it looks like the future also is full of passion and full of collaboration, as you mentioned, to support people with vision impairment. Would you like to ask me any questions?
What do you think, Hisham? How do you think that Roche could collaborate effectively with patients' organizations?
So I believe collaboration is key. We believe that we cannot do it alone. As a healthcare industry, as Roche, we believe, as you mentioned, also patient organization cannot work alone. So we need really to work together, patient organization, Roche, the healthcare industry, the policymakers, even the Ministry of Health. There are multiple stakeholders that can support, because the problem itself is very complex. When you speak about access to screening, access to diagnosis, access to innovative treatment, how we improve the rehabilitation of our patients. So the problem is very complex, and that needs a lot of innovation, a lot of expertise, and a lot of resources. By coming together as a patient organization, as Roche, as other stakeholders, we are able to pool resources and to work together. We believe at Roche that we have a big commitment for empowering people with vision impairment and provide them with the right tool to really go to this future state that you mentioned. And again, it sticks with my mind, the well-being, the productivity, and not only for them, but really for their families and for the society as a whole, for the healthcare system as well.
Do you have any idea how we can jointly shape the healthcare policy in the field of vision health, in the field of eye care? Here, probably you know, of course, I'm sure you know that there are brilliant UN resolutions on eye care, a vision for everyone. There are really comprehensive resolutions for aging, for healthy aging. It is even, we are living in the decade of the healthy aging. There is also WHO recommendation. There are targets given by WHO for vision health. Regretfully, they are not implemented in Europe. How do you think that we can really shape the future of these policies? How we can shape these policies in Europe and in Bulgaria?
Definitely there is a pressing need to have a policy, as you said, a vision for vision health and a clear policy and approach how we can going to support those people. Because now what you are seeing today, either for Bulgaria and for Europe, that more and more patients are coming to the system and the system is not supporting them early enough. The challenge, it's not only a personal health challenge for people with vision impairment, it's also a big burden on the families and on the healthcare system. Because on the families, it's really stressful to take extra care of people with vision impairment. And for the healthcare system, there is a need for significant resources to support them. So definitely we need to have a clear assessment and to see that this is really a priority driven by what you mentioned, like the UN resolution or the WHO recommendation, to really consider vision health as a priority in Bulgaria and in Europe. And definitely if we have it as a priority and we have a clear vision and clear policy, we will end up improving access to screening, as you said, access to diagnostics, both in big cities and in capital like Sofia, but even outside Sofia as well. And then access to innovative treatment, and finally, how we can ensure the treatment outcome and rehabilitation of our patients. So I believe, as you mentioned earlier, it takes a lot of collaboration, need a lot of support between the healthcare industry, between patient organization, between policymakers, the Ministry of Health. You know, there are, I think, very strong movement that can help us to create this policy and really prioritize vision health in Bulgaria.
Oh, thank you so much. I hope that we'll try jointly to address the needs of people, of those who live with eye diseases, let's say, in common, but as a retinal patient, of course, we are more focused on patients with retinal diseases, which I have mentioned, but let's hope that we'll try jointly to address them and to educate a little bit the politicians what they can do in the healthcare strategy in order to build a comprehensive, let's say, eye health framework, policy framework in Bulgaria at the minimum.
So what would be your final message, I mean, to really drive those policy changes and improve the care for people with vision impairment? What would be your final message and remarks?
In Bulgaria.
In Bulgaria, yes.
Oh, firstly, there are very concrete things actually that they're supposed to do. Actually, firstly, it's good really to have the eye care in the national health policy. It isn't there. We have the national health strategy, but we don't have eye care in the national health strategy. So something, probably number one, what we are supposed to do is really to ask the politicians to propose them, to give to them proposals where exactly to include if they would like, but we have also to build a case to explain to them why they have to include that into the national healthcare strategy. It's, let's say, the first thing, because without having eye care in the national health strategy, we could not expect to have afterwards a comprehensive eye health plan with a respective budget, with objectives, with targets, because You know that budget is a secondary thing. Initially, there should be targets and actions. So it is the first thing what we have to do, to have the eye care as a priority into the healthcare strategy. It is also up to us to discuss in the right way with the politicians where should it be situated, whether it should be situated separately in the national healthcare strategy, or it could be situated partially in the geriatric care for people who are aging, or somewhere in another pieces of this eye health strategy, but without having something into the eye health care strategy, we could not achieve too much.
We know that we have a challenge in Europe with demographics. So I would be very curious to know your recommendation on how to support aging people.
Actually, Hisham, you know probably that the sight is needed at each particular stage of the life. And people in the younger ages, they have their opportunities to adapt in another way. It depends when the vision is going to be lost. But especially for aging people, when people are aging, there's some very important declines. And the declined vision is among them, and it is recognized worldwide by the WHO, by everybody. So regretfully here, in our case in Bulgaria, it is not recognized by our policymakers at all. Those who are related to healthcare and also to social affairs, that the vision of the aging people is important, and they have to do something. When we are representing our patients, our cohort, these are people with diabetic retinopathy, but anyway, they are not so much. They don't belong too much to the aging population. There are people who, of course, will age with a visual impairment, but with regards to people who are developing AMD in their 50s already, regretfully, but especially in their 60s and over their 60s, the AMD is not recognized, the age-related macular degeneration isn't recognized yet as a disease, which impacts heavily the quality of life of the patients and of their families. We have already this data, how it impacts their quality of life, and we know that when we are talking about socioeconomic impact, actually the indirect costs which are related to treatment and so on are just only the tip of the iceberg of the impact of the disease. The biggest drivers in terms of spendings, in terms of these are the well-being and productivity. And actually what we should try to do is to demonstrate to the payers, to the policymakers, that it is a really quality damaging disease, both for the patients and for the families, and that we have to find the solutions how to change the policy in terms really to support the well-being and the productivity of these people.
Thank you so much, Petya, for the insightful discussion. And indeed, we have a clear call to action to have vision health as part of the national health strategy. With that, we will be able to improve our approach to screening. We'll be able to have a better access to diagnostics and innovative treatment, ultimately support the rehabilitation of our patients and have more well-being and more productivity, because healthcare matters.